Welcome back. We are the Cribsiders. We are the pediatric medicine podcast where we interview leading experts in fields to bring you clinical pearls, practice-changing knowledge, and answer lingering questions about core topics in pediatric medicine. What episode are we summarizing for us today, Justin?
That's right. So we're doing a video summarizing our recent episode on Kawasaki disease. We have an international expert, Dr. Audrey Tremoulet, who is the assistant director for the Kawasaki's Disease Research Center over at University of California, San Diego. She is a repeat guest for us. She also did our Miss C episode earlier on, brought us lots of pearls. Very cool. One of the first things is just kind of overview of the criteria for Kawasaki's disease, but with a couple nuances that she was really helpful in explaining. The first is the common eye redness. It is not a conjunctivitis, it's not actually swelling, but it's an eye redness that's limbic sparing, so it kind of saves the whites of the eyes. One of the major features of Kawasaki's disease. In addition to the eye redness, we have the non-specific rash. Pretty much anything except a vesicular rash that is not consistent with Kawasaki's disease. Another great pearl. Edema of the hands and feet. Cervical lymphadenopathy, usually unilateral, and then changes in the lips and oral cavity with a strawberry tongue. The other things we kind of talked about that were important clinical findings of Kawasaki disease, often kids can present with just a limp, and it can be an arthritis or another sign of the inflammation throughout the body from Kawasaki's. And this periungual peeling, or a rash around the toenails and fingernails of a peeling rash, is a very common finding with late-stage Kawasaki's.
Now, something you got to keep in mind is if you have incomplete Kawasaki's, meaning they only get 2 to 3 plus out of the 5 things that you need for Kawasaki's plus a fever, you really need to do more of a lab workup. And this includes a bunch of the biomarkers, which is really a measurement of inflammation associated with higher risks of coronary artery aneurysm. These biomarkers include ESR, CRP, white count, albumin, ALT, GGT. These are things that are going to help us through that whole workup.
Yeah, and I think these are great risk factors for looking at coronary artery aneurysms. Some of the other risk factors that she mentioned, age less than 6 months, any laboratory extremes. So when you start seeing high platelets in the millions, that can be a pretty bad sign. And then an earlier rise in inflammatory marker is another sign of possible higher risk of coronary artery aneurysm.
Another big takeaway that we talked about in this episode is, what if people fail that first IVIG course with steroids? Well, you can actually, second-line options include repeating IVIG. You can do steroids, anakinra, or infliximab. Also, another thing we talked about is after discharge is talking about getting a TTE 1 to 2 weeks at that point. Anything else, Justin?
No, that was a lot of pearls. It was a great episode. We go into more details about some of the demographics of Kawasaki disease. Definitely worth checking out at any podcast app that you can find.
Well, see you guys later. Bye.
Check us out.